Minnesota authorities are turning to the international law enforcement agency Interpol for help in finding 13-year-old Daniel Hauser and his mom Colleen. The most recent confirmed sighting of the pair was Tuesday in Southern California. Now, Danny is suffering from Hodgkin's lymphoma. Doctors think chemotherapy is his only chance to survive, but his family is refusing those treatments over religious reasons. Joining me here in studio to talk about it, Dr. Francisco Contreras, the president and director of the Oasis of Hope Hospital in Tijuana, Mexico. Also joining me live from Cleveland is Dr. Jonathan Fanaroff, Associate Director of the University Hospital's Rainbow Center for Pediatric Ethics. So, doctors, both of you, good morning.
Good morning. Good morning.
Dr. Contreras, you're right here, so I'm going to talk to you first. From an ethical standpoint, what do you think is right here? Is it a judge's right to tell a parent what to do, or is it a parent's right to make that decision for their child?
Well, I believe that the parents' rights can be challenged when they are intellectually, emotionally, or faithfully challenged, because information here is paramount. When a tumor can be cured in more than 80% of the cases, you have a very strong case that the patient should take that therapy.
Okay, Dr. Fanaroff, your take, sir?
The parents are absolutely in this country felt to have the best interests of their child as their obligation. And in a case like this, parents generally do decide what should be done for their child. But when you have a greater than 80% chance of survival with treatment, then they really should get the treatment for their child.
Yeah, and I'm just going to throw in a couple of tweets I've received because I've had a lot of passionate response from viewers. Did this earlier in the week. It was more mixed than I'm getting this morning. A couple of them from Barkway. While I fully support parental rights, I don't think a parent can choose death for a minor solely for religious reasons. Another one, Shy Jinx writes, let's see, where did that one go? Let's see. Oh, shoot, that was a really good one, too. Oh, there it is. I think the mom should be more concerned with keeping her child alive and less concerned with religious values that deem such action as wrong. So, Dr. Contreras, if the parents don't want a child subjected to this kind of difficult chemotherapy treatment, why should the government, though, step in and force? Because you've got an arm of the law saying we've got to find this guy and bring him back, this child.
Yeah, I think, in my opinion, most of these cases are due to lack of information. I've had already 4 children come to me in Mexico from parents that are fleeing the orders of judges in America, and we have been able to convince them to take the therapy from which they were fleeing from. And so it comes to the point where a parent at the first time looks at the child suffering tremendously from chemotherapy, because chemotherapy can be brutal. And when a doctor doesn't take the time or the effort to diminish the side effects, a parent can be terrified and, you know, make the wrong decision because they feel that the chemotherapy is going to kill the child.
So your suggestion of fear is something, certainly. Dr. Fanaroff, what do you think in terms of the point that a judge should step in and overrule a parent in terms of treating a child, this time with regard to religious reasons? I mean, we've got religious freedom in this country, so it's a very fine line that a judge has to walk.
Absolutely, and if you look at the judge's opinion, he fully supports parents and children absolutely have the right to whatever religious beliefs they desire. However, that doesn't change the fact that the parents still, for their child, they're not making a decision for themselves, they're making a decision for their child, and they have to do what is child's best interest. So the judge in this case, everyone fully supports the parents' rights to religious freedom here, but that doesn't change the fact that they must obtain the best treatment for their child.
So in summary, both of you believe that this child should come in for medical treatment and the mother is wrong for keeping the child away from the hospitals and chemotherapy, doctor?
In this
Dr.
case,
Contreras?
because the possibility of cure is so high, I believe that she needs help.
Dr. Fanaroff?
No one likes to see the police involved in arrest warrants, and everyone believes that the mom is trying to do what's best for Daniel. But in this case, with a highly treatable, greater than 95% cure with treatment, greater than 95% death without treatment, he needs treatment, and it's and from an ethical standpoint, that's what has to happen.
I think also every once in a while people need to employ common sense, as fearful as it may be. Dr. Contreras, Dr. Fanaroff, gentlemen, thank you so much.
Thank you.
Coming up at the top of the hour, more on a breaking story. NASA calling off all of today's